Okay, let's unpack this. Today, we're embarking on a deep dive into a really critical topic. It's about how our growing human population, our daily activities are, shaping global health. We're talking everything from new infectious diseases popping up to, well, the slower, quieter spread of chronic conditions. It's a fascinating connection and honestly, vital. It impacts every single one of us, often in ways we don't immediately see.
Indeed. And the sources we're looking at today, they really highlight a profound truth. Our health, human health, is just so intimately tied to the health of, well, everything else, other living things, our environment. So our mission for you, our listeners, is to kind of go beyond the headlines, to understand not just what's happening, but the why behind these complex health challenges and really connect the dots,
Yeah.
across social systems, economic ones, ecological ones. Hopefully you'll walk away with a much richer understanding of these interconnected risks and maybe some potential paths forward.
Right. We hear the word zoonotic a lot now, especially after, well, recent events. Everyone knows it. But our deep dive into the sources, it shows how much our changing world is actually speeding up their emergence. What's maybe the most unexpected thing our research uncovered about this?
Well, it's not just the basic definition. A disease passed from animals to humans, like COVID-19 likely from bats. The truly staggering thing is the sheer scale of the potential threat. Scientists estimate there are something like 1.7 million undiscovered viruses just in mammals and birds, and many of those could potentially infect us. Plus, get this, an estimated 75%, three-quarters of newly emerging infectious diseases, they're zoonotic. So it's not just history, it's an ongoing active process. Our actions are basically creating the pathways for these junks.
Wow, 3 out of 4 new diseases jumping from animals. That really does put it in perspective. Now, something from the sources that really gave me pause was this direct link between global population growth and these diseases emerging. It feels kind of intuitive, but what's the actual mechanism? How does just having more people directly mean, more viral threats?
It's a crucial point.
Yeah.
And it's not just about the raw number of people, it's about how those numbers force us to interact differently with the environment. Think about it, human population took like thousands of years to hit the first billion. Then boom, just 2 centuries later, we're at 7 billion. And the UN thinks we'll hit nearly 11 billion by 2100. That kind of exponential growth means we're constantly pushing into new areas, chopping up animal habitats. Yeah. Every new farm, every new road, every bit of cleared forest, it just increases the contact points between humans and wildlife. More opportunities for a virus to make that leap.
So it's not only the sheer number of people, but the increasing density and the reach of our human footprint.
Exactly. And then, once a spillover does happen, those same dense populations, especially now with global travel, they become super spreaders. Think of a city like Hong Kong, 68,000 people per square mile. It shows just how fast a local outbreak can become a global problem. It's really a double whammy. Our expansion creates the contact, and our density fuels the spread.
Okay, so biodiversity, it sounds like something we definitely want. Good for the planet, right? But the sources we looked at suggest it's, well, more complicated when it comes to disease risk and human activity. A bit of a paradox. Can you untangle that?
It's a bit counterintuitive, yeah. So while diverse ecosystems naturally hold a lot of potential pathogens, it's actually the loss of biodiversity, often because of human disruption, like deforestation or habitat fragmentation, that can paradoxically make us more vulnerable. See, when we damage habitats, certain species thrive in those disturbed environments. Think rodents, bats, some birds. And these survivors, they often happen to be good hosts for pathogens that can jump to humans. Take Lyme disease or West Nile virus. The risk is actually higher in places with low biodiversity, like suburbs, these human-dominated landscapes. Whereas in big, intact forests with lots of different species, the ticks or mosquitoes have more choices of animals to bite. Most of those other animals aren't great reservoirs for the pathogen, so it dilutes the risk to humans. It's called the dilution effect.
Huh. The dilution effect. So having more types of animals around can actually protect us in a healthy ecosystem.
Okay, so it's not just about avoiding strange animals, it's about the whole system's health. Now, beyond just our numbers, our specific actions are really shaping this risk. Our sources point to particular human activities that are basically accelerators for these viral jumps. What's top of the list?
Well, from an epidemiological viewpoint, there are a few big ones. The global wildlife trade is massive. We're talking a multi-billion-dollar industry. Often there's corruption involved. Animals sold for pets, food, medicine, luxury stuff. Legal or illegal, these exotic animals are just more likely to carry new diseases we haven't encountered. But the real kicker is the conditions. During transport, in the markets, they're crowded, unsanitary, different species all mixed together. It's like the perfect breeding ground for diseases to swap hosts and jump. The UNODC says it pretty bluntly. Wild animals would not pass on these pathogens to humans if we didn't bring them to our cities, markets, and shops. We're basically inviting them in. Right, so it's not just the initial jump maybe in a forest somewhere. It's the whole chain capture, transport, market that creates these incredibly risky environments, like a perfect storm for germs to evolve.
Absolutely. And that connects directly to another major driver, intensified agriculture.
Hmm.
Specifically, these concentrated animal feeding operations, or CAFOs, these massive facilities where thousands upon thousands of livestock, chickens, pigs, cattle are crammed into tiny spaces. The UN figures CAFOs supply most of the world's poultry, eggs, and pork now. Think about it. Crowded, stressed animals, huge amounts of waste. It's just an ideal setup for diseases to brew and spread. Things like bird flu, swine flu, they can even become airborne from the ventilation systems. And then there's the, frankly, dangerous practice of feeding diseased animal parts back to other animals. Remember mad cow disease in the UK? That's how it spread.
Yeah, I remember that. And the 2009 H1N1 swine flu pandemic, that really highlighted the risks of these huge industrial farms, didn't it?
It really did. That pandemic, which went global pretty fast, likely started on hog farms in Mexico. Researchers argue these area foes basically provide a constant laboratory for viruses. They can replicate, mutate, even recombine into totally new strains. And there's a social justice angle, too. These huge operations often end up located near low-income communities, often communities of color. So those people bear the brunt of the environmental fallout, water contamination, air pollution, and, higher risk of infection. Look at North Carolina, for instance. Almost as many hogs as people. The nearby communities face documented, elevated health risks.
It's a pretty grim picture when you lay it out like that, the sheer scale. Thousands of animals packed together. Almost feels like we've designed these systems for pathogens to flourish. Was there a specific statistic about CFOs that stood out in the sources?
Well, maybe not a single stat, but something that runs through it all is the massive use of antibiotics. Over 70%, 0% of all antibiotics used globally go into food animals, often just to prevent disease in those crowded conditions or promote growth. And that is a huge driver of antimicrobial resistance. AMR, that's another slow burn crisis, making common infections potentially untreatable down the line.
Okay, so we have the wildlife trade, industrial farming. What about habitat destruction and deforestation? That seems obviously linked, but how exactly does it increase risk according to the sources?
Yeah, the correlation is really well established. When we clear forests for timber, palm oil plantations, cattle grazing, whatever we break up natural habitats, that fragmentation brings people and wildlife into closer, more frequent contact than they normally have. Ebola outbreaks in Africa, for example, have been linked to forest clearing activities. And remember the dilution effect. Small forest patches often can't support large predators, so you get an explosion in the numbers of small animals, like white-footed mice in North America, which are key carriers for Lyme disease bacteria. More mice, more risk for people nearby. We see it with malaria, too. Deforestation in the Amazon has actually created better breeding grounds for the mosquitoes that carry malaria. And a really stark example was the Nipah virus outbreak in Malaysia back in '98. Fruit bats, their habitat disturbed by deforestation and fires, were drawn to fruit trees planted near large pig farms. The virus jumped from bats to pigs, amplified in the pigs, and then jumped to the farm workers, a classic spillover pathway created by land use change.
It's honestly quite sobering, seeing how all these different activities, trade, farming, cutting down forests, they all kind of weave together into this incredibly complex web of risk. It really hammers home that point you made earlier about our overall human footprint, doesn't it?
It truly does. And none of these things happen in a vacuum, right? Deforestation, for example, also fuels climate change. And climate change itself pushes disease vectors like mosquitoes and rodents into new geographic areas. So it's all interconnected. Shows how deeply our global economic systems, how we produce things, how we live, are tangled up with our health risks.
Okay, so as alarming as those infectious disease threats are, our deep dive also uncovered this other quieter crisis that's escalating: chronic diseases. The sources paint a really stark picture, especially about where this burden is falling hardest.
Absolutely. It's easy to focus on the sudden outbreaks, but chronic, non-communicable diseases, think heart disease, cancer, respiratory disease, diabetes, they're a huge killer globally. We're talking over 31 million deaths a year from just those four. And here's the really striking part. Nearly 80% of those deaths, they happen in low middle income countries. In those countries, chronic diseases actually kill about 80% more people than all infectious diseases combined. That surprised me. And the projections are worrying. By 2030, chronic diseases are expected to cause almost 60% of all deaths worldwide. That's over 37 million people a year. What's really insightful from the research is that this isn't just because infectious diseases are going down. Chronic diseases are actively rising much faster in developing countries. Like in East Asia and the Pacific, the projected increase in chronic disease deaths is expected to be more than 5 times the decrease in infectious disease deaths.
Wow, so it's really shifting the landscape of global health. And it's easy, maybe too easy, to just think, oh, chronic diseases, that's just people getting older, or it's a rich country problem.
Hmm.
But our sources really push back hard on that. What's the main misconception we need to get past here?
That's such an important question, especially for policymakers. Because yes, age is a factor, obviously. But the research we looked at strongly indicates that these bigger forces, macrosocial, macroeconomic factors, are much more significant drivers. The idea that it's all just population aging, the sources call that incomplete on methodological, empirical, and policy grounds. It can even be misleading. Because look, the rates of these diseases are falling faster in some places than others, and differently across age groups. Aging alone just doesn't explain that variation.
Okay, so if it's not mainly age, what are these powerful forces driving this surge, especially in developing nations?
We can kind of break it down. First, there are the behavioral risk factors. These are huge. They account for maybe 30% to 60% of chronic diseases, and the burden is growing everywhere. We're talking tobacco use, which is projected to kill 50% more people than HIV/AIDS back in 2015, alcohol, unhealthy diets, lack of physical activity. And these things add up over your lifetime, right?
Right, 30 to 60% from behavior alone. That's massive. So how do bigger economic trends then sort of pour fuel on that fire?
That brings us to the second driver, economic flows and globalization. Our interconnected world makes it super easy for goods to flow, especially things like processed foods, sugary drinks, cigarettes, often flowing from the global north to the global south. Big transnational companies have sophisticated marketing. They can often outcompete local producers. So as incomes start to rise in developing countries, these Western-style processed foods and drinks become more available, affordable, and even, desirable. Status symbols almost.
So the market itself is actively pushing less healthy options, especially in places undergoing rapid economic change. What happens to lifestyles then as incomes go up?
Yeah, that's the third point, which is kind of fascinating. Economic growth and lifestyle shifts. What's interesting is that as incomes rise in places like India or China, people often adopt unhealthier habits initially. More processed food, less activity. It's kind of the opposite of the trend in already wealthy countries, where higher income often correlates with healthier choices now. Part of it is that aggressive marketing associating Western consumption with modernity or success.
And our modern way of working, living in cities, that plays a role too.
Definitely. That's the fourth piece. Technological change and urbanization. We've shifted from largely agrarian work to more office-based intellectual labor. That means more sitting, less physical activity built into the day. And urbanization, especially rapid urbanization in developing countries, often doesn't come with, say, lots of green spaces or safe places to walk or bike. Food environments change too, more reliance on eating out, street food, processed options. Plus, as more women enter the paid workforce, there's often less time for traditional home cooking, which again pushes people towards convenient but often less healthy food choices.
So it really does sound counterintuitive. The very things we think of as development, economic growth, urbanization might actually be fueling this chronic disease crisis in lower income nations. What's this paradox of development the sources talk about?
That's exactly it. The research highlights this paradox. In poorer countries, things like higher per capita income, more integration into global markets, more foreign investment, more urbanization, all those things are actually associated with higher rates of death from heart disease and other chronic conditions. But in high-income countries, that pattern reverses. Those same factors are generally linked to lower chronic disease mortality rates now. It really suggests that how development happens, the specific policies and choices made along the way, is absolutely critical for health outcomes.
And beyond the immense human cost, the suffering, what about the wider economic impact if millions are getting sick during their working years?
Yeah, that's a crucial question for long-term global development and equity. The burden of chronic disease significantly slows down economic growth. One analysis showed that just a 10% increase in chronic disease deaths among working-age adults could shave off nearly 0.5% from a country's economic growth rate. That creates what the sources call a chronic disease poverty trap. It makes it harder for developing nations to climb out of poverty, and it threatens to widen that already huge health and wealth gap between nations.
Wow. Okay, the scale of both these challenges, infectious and chronic, feels enormous. It's easy to feel a bit, pessimistic. But the sources don't just leave us with the problems. They do offer strategies, ways to potentially mitigate these risks. Where do we even start?
Right, it's not all doom and gloom. There are paths forward, but they require a really integrated approach. First, we need to truly embrace and integrate this One Health concept. The core idea is simple but powerful. Human health, animal health, and environmental health are completely intertwined. You can't address one in isolation. This needs to cut across everything: public health, yes, but also agriculture, finance, urban planning, trade policy, all of it. We saw examples of this working, like the successful containment of Ebola in Lagos, Nigeria. Despite being a huge, dense city, they managed it through a fast, coordinated response using existing public health infrastructure and really intensive contact tracing, even using GPS data. It shows collaboration and infrastructure are key.
That makes total sense, a joined-up approach. So for those immediate pandemic threats, what does effective strategic preparedness look like in practice?
Yeah, for pandemics, acting early is everything. Early recognition, early mitigation. The most cost-effective things are often strengthening the basics: core public health infrastructure, clean water, sanitation, robust disease surveillance systems so you know what's happening. Also vital are good risk communication strategies and having rapid response teams ready to go. Vaccines and antiviral drugs are obviously critical tools, but they only work if you can deploy them quickly and fairly. And that's a huge challenge, especially for low-income countries, where stockpiling enough for everyone can be incredibly expensive and logistically complex. Equitable access is key.
Okay. And then for the chronic disease epidemic, which feels like a slower, more systemic problem, what's the big shift needed there? How do we rethink economic growth?
Well, for chronic diseases, we fundamentally need to align economic development with health goals, not see them as separate or competing. That means working with the private sector, encouraging them to develop and market healthier product lines. Public health needs to become almost like health investment advisors, showing the economic benefits of preventing disease. It also means actively fighting those myths, like the idea that chronic diseases are just an inevitable part of aging. That kind of thinking can really stall policy action. Think about the Millennium Development Goals. They were really successful in reducing deaths from infectious diseases. Great achievement. But because they didn't explicitly target chronic diseases with the same focus, we kind of risked solving one major problem while letting another one grow almost unchecked in many parts of the world.
This whole deep dive, it really has just laid bare how incredibly interconnected everything is, hasn't it? From how we interact with wildlife, how we farm, right down to the economic systems that shape what we eat and how we live. It's so clear that human health isn't just about doctors and hospitals. It's about our whole relationship with the planet and with each other.
Precisely. And maybe connecting all these dots leaves us with a final thought, a question for you, our listener. What if our efforts to tackle one kind of health crisis, say, focusing only on pandemics or only on chronic diseases, what if doing that in isolation inadvertently creates the conditions for the other crises to get worse? The sources hint at broader connections. For instance, they suggest that slowing population growth through voluntary means like ensuring access to education, especially for women and girls, and access to family planning could have multiple benefits. Benefits for human health, for the environment, for economic development. This idea of reproductive autonomy not just as a human right, but as a potential driver of wider positive change. It offers a really powerful, proactive way to think about our collective future and how we manage these complex, interconnected health risks.